Okay, recording. So we're going to do a review. I should probably share my screen. Can everybody see my screen? Radiographic, pathology, purple background. Okay, cool. Okay, so we're going to just go through some images. And you can talk out loud or not, whatever, or take notes. So that is multiple myeloma. And you can tell because of all those lytic lesions. Multiple myeloma, that's a blood cancer, and it's just eating away. This is ankylosing spondylitis, also called Marie Strumpel disease. It's that bamboo spine. And remember the guy in Mick Mars from Motley Crue has this. So you can see everything is just turning into like this bamboo spine. That would be polydactyly. Poly means more than one or many. Dactyly, fingers, think of a pterodactyl, and you can see there are 6 fingers. So that is congestive heart failure, or CHF. And you can tell because there's an enlarged heart and there's some blunting of the costophrenic angles. That's a pneumothorax. That's a big one. Ways to tell, see how it's almost completely black and you don't see these white vascular markings? So pneumothorax is air in the thoracic cavity. So it's a collapsed lung. It's literally hanging. So that's when air leaks into the space between the lung and the chest wall. And so the air is pushing on the lung, so it collapses. So that's a good picture there. And you can see how it's collapsed and it's all black. You don't see all this white stuff over there. That's a great picture of emphysema. I've talked about that a couple of times. Emphysema, that's that barrel chest, really long lungs. It's due to damaged, enlarged air sacs in the lung. This is common, like people who are smokers, their lungs kind of look like this. And you can tell that this is emphysema just because of the barrel chest and the blunting. I know it's a little tricky. It kind of looks a little bit like a pneumo, but there is white crap kind of all over the place. But the one before, I mean, there's white stuff all the way on the right side, but there's nothing over here. And that's emphysema. That would be a pleural effusion. Effusion is usually fluid, and there's a horizontal line there as if it's filled with fluid. Remember, we do to check for a pleural effusion, you want that horizontal beam to check for air fluid levels. So that's definitely one there because it's completely straight across. That's OI, osteogenesis imperfecta. That's the zebra stripes. So that's an easy way to remember. I mean, OI, all the zebra stripes, that's a telltale sign there. So this would be a rolling hiatal hernia. A hiatal hernia is a condition in which like part of the stomach pushes up through the diaphragm muscle, but the esophageal stomach junction is like under the diaphragm. And this one would be rolling, you can remember, because it's literally like rolled to the front. And you can also tell this is fluoro, and fluoro is a good way to check for hiatal hernias. That would be esophageal varices. Varices are the enlarged veins, and it's esophageal. You can tell this is an esophagram. It's also that worm-like appearance. We've definitely seen this picture before. So enlarged veins in the esophagus. Apple core lesion. I believe that's a type of, colon bowel cancer, but it looks like, when you eat an apple and you leave the core. So that's a telltale sign there. This is going to be hepatomegaly. Hepato means liver. Think of hepatitis, and megaly is big. This is a giant liver. And you can tell this is not a large person. So hepatomegaly, big liver. There are 3 kidneys there. We only have 2. So that's going to be supernumerary kidney. Super meaning, more or big, and numerary number. So more than one. So 3 kidneys, boom. What else? Let's see. Horseshoe kidney. It's a kidney and it looks like a horseshoe. It's fused. This is a Wilms tumor, and you can tell Wilms tumor, that happens in kids. It's like a kidney tumor, and that's definitely a kid because that's a very small person, and look how huge that tumor is. And yeah, so that's a Wilms tumor. This would be multiple sclerosis, MS, because you can see those little white plaques in the brain. Usually you use MRI to detect that, and that's an MRI. Bicornuate uterus, that's the uterus that has 2 horns. Bicorn, 2 horns uterus, and it's heart-shaped. And that's probably an HSG or something. So that's an easy one to kind of pick out. This is osteosarcoma, the cancer, and it has a sunburst appearance. Just skip that. That is Montesia fracture. Remember, I remember it as like climbing a mountain and you bust up your arm. It's the proximal forearm thing going on there. So that's an easy way to remember it. Mountain, bust your arm. That looks like osteomalacia, lace. Remember, lace is delicate, it's light. Also like rickets, this is the vitamin D deficiency. And I think I mentioned that you can see this in kids that are kind of like bow-legged because everything is weak. So osteomalacia right there. You can tell with the bowed legs. That's going to be hydrocephalus. Hydrocephalus, that's like water on the brain. These are ventricles that house CSF, and they're huge. So because the ventricles are enlarged, that's going to be hydrocephalus. So that's how you can tell this, even though you're like, oh, the brain, the ventricles are huge. So water on the brain, okay? That looks like a nuke med study checking for a thyroid cancer because your thyroid is like a butterfly and it's right here. And this is indicating that that area is not absorbing the radio tracer, and it should. And it's not absorbing anything because there's cancer there. It's like blocking it, it's eating it. So that is a thyroid cancer. And that's like a cold spot. Not a hot spot. Hot spots are when they show up everywhere. So that would be just an HSG, really, because it's, HSG is hysterosalpingo, so it's uterus, fallopian tubes, and it's fluoro. There's contrast going up. That's a good one to know. That's a bowel obstruction or an ileus. You can tell because there's all this air and nothing's really moving, and that's showing, your small intestine, large intestine. It's huge. So that's a good one for a bowel obstruction. That's when there's digested material is like blocking the bowel. It's not moving through the bowel. That looks like pneumonia. Usually I've seen pneumonias usually like kind of concentrated, usually like the upper or middle lobe in just one lung, unless they have bilateral pneumonia, but that would be pneumonia. So there's infiltrate, there's fluid, there's all this gunk here. And I tend to see it in the middle lobe, but maybe that's me. That's going to be, that's a AAA, an angiogram. That's like abdominal aortic aneurysm. Remember, your aorta goes all the way down into your abdomen, and it looks like, you can kind of see like the spine back here and the hips, and it's ballooning. And then your aorta bifurcates down into your legs, or femur. And you can tell it's AAA because that's IR, because they're putting a needle in there. Okay, that would be, that's an avulsion fracture. Remember, avulsion is like a pulling or tearing away. And I said it's common with like your ankles and your feet because you're kind of rolling onto it. Football sign, pneumoperitoneum. That is where you have air in the abdominal cavity. Pneumothorax is air in the thorax. Pneumoperitoneum is air in the peritoneum. And there's just all this air here. It's just one big giant, football, basically. That is a green stick. Remember, that happens in kids. I think of like a piece of grass or a green crayon. It's an incomplete break. So it's just the edge there. That would be a gastric volvulus. A volvulus is where something is like twisting on itself. And looks like they're trying to do an oblique here, but the stomach there's contrast in the stomach and it's twisted. So that's how you can tell that. And it's fluoro. Hangman's fracture. Hangman's fracture is C1 and C2, and they've got it outlined for you there. And hangman's fracture, think of like hanging yourself. So you're going to affect this area. This would be hypoplasia and hyperplasia. That's where like this one's bigger, this one's smaller. And we've got kidneys here. This is a leiomyoma. That is a benign tumor of the esophagus. A leiomyoma is similar to a fibroid, and that's in the esophagus because that's, an esophagram or like a swallow study. And that's a way to check it by doing fluoro. This is just a liver biopsy because the liver's here and you see that big needle coming in there. Nephrostomy tubes. because your kidneys are up here, the bottom of your ribs and your back, and neph tubes are usually like stuck in your back there. And a lot of times we do a KUB to check that the tubes are in a good spot. And then you've got the little pigtail there. That's a sign too. That is a Schatzki's ring. That's all you really need to know. Schatzki's ring, that is esophageal. And you can tell because it has this like ring appearance. Like that apple core lesion is usually colon, and it actually looks like it's an apple that's been eaten minus the core, but that is a Schatzki ring. That's an esophageal thing. And this is definitely fluoroesophageal. This could be esophagram or upper GI because they're drinking and then this is happening here and then it's going into the stomach because that's all the rugae right there. That would be uterus didelphisis. That's that duplication of uterus, cervix, and possible 2 vaginas. So there's an entire body there, an entire body there. And it would be uterus because this is a ultrasound. We're not going to be, for reproductive, we try to do ultrasound and MRI because of it's non-ionizing radiation. This is just fatty liver disease. Think of where your fat is on your body, and then that's your liver. It's almost the same color, and it has all these deposits all over the place. And that would be Zenker's diverticulum. That's an esophageal diverticulum. You can tell because this is fluoro, it's going down their esophagus. A diverticulum, again, is like an outpouching. Boxer fracture, remember when you punch someone in the face or wherever, you can break the fifth bone there. That would be a basilar skull fracture because it's the base of your skull. So basilar skull fracture. That's just like an NG tube. NG tube, nasogastric, nose, stomach, looped. That would be a pacemaker, defib, probably that looks, I think that's a pacemaker. Actually, maybe not, I don't know. But usually the defibrillator is bigger, thicker, it's got more stuff going on, okay? All right, so let me go back. So I know I kind of went through that quick, I went through that. So real quick, I'm gonna go through these again. And I'm just gonna give you the title in case you were like writing notes and all that stuff. So we'll be quick here, okay? Multiple myeloma, ankylosing spondylitis, polydactyly, CHF, congestive heart failure, pneumothorax, emphysema, pleural effusion, OI, osteogenesis imperfecta, rolling hiatal hernia, esophageal varices, apple core lesion, hepatomegaly, supernumerary kidney, horseshoe kidney, Wilms tumor, multiple sclerosis, MS, bicornuate uterus, osteosarcoma, yeah, osteomalacia. Oh, no, sorry, that's totally not it. That's a Montesia fracture. I skipped over something. There we go. That's osteomalacia, rickets. That would be hydrocephalus, thyroid cancer, HSG, bowel obstruction, pneumonia, AAA, avulsion fracture, pneumoperitoneum, football sign, green stick fracture, incomplete fracture, gastric volvulus, hangman's fracture, hypoplasia in one kidney, hyperplasia in the other. Hypo means less than, hyper means too many or more than. Leiomyoma, that's a liver biopsy. Nephrostomy tubes, Schottky's ring, the uterus didelphisis, fatty liver disease, Zenker's diverticulum, Boxer's fracture, basilar skull fracture, NG2, and pacemaker. Let me pause. Okay, recording, share screen. Everyone can see this. So I'm just gonna click on stuff and you can just kind of take notes and just see how much you know this stuff. So let's start with skeletal. So it's breaking down into categories. So let's start here. Dwarfism. Achondroplasia. Remember, that's a type of dwarfism. Rickets, softening of the bones. That's osteomalacia. Remember, lace is soft, softening. We actually just saw that picture. That's like bow-legged, vitamin D deficiency. Yes, osteomalacia. Okay. Premature closure of cranial sutures. So this is craniosynostosis. And if you break down the word, cranio is skull, syn is like synthetic or joining together, and osis usually means abnormal condition. So if you break down the word, that is where everything is in the brain, like the skull is closing too soon or too fast. When in doubt, try to dissect the word and see what does this mean. Brittle bone disease. That is the same thing as osteogenesis imperfecta. That's the zebra stripes I showed you guys. So osteogenesis, bone forming imperfect. They're brittle. So break down the word. Here we go, skeletal. What? Did I just do that? I did. Okay, sorry. Yeah, I did that. 500. What does this look like on a picture? Zebra. Showed you that, the zebra stripes. So that's a pretty easy one. So that's all skeletal. Everybody okay with those? Okay. All right, abdomen, GI, liver, all that. Difficulty swallowing, dysphagia, dysfunctional, bad, phagia, swallowing. So difficulty swallowing. Inflammatory disease, colon, starts at the anus and goes up. Ulcerative colitis. Remember the difference between ulcerative colitis and Crohn's? Remember, CD equals RE. So CD is Crohn's disease, RE is regional enteritis. So this has the word colon in it. Your colon is your large intestine. And that question was talking about anus going up. So it's going up your colon. So it's that area. And then with Crohn's disease or regional enteritis, that's where it can be in different regions throughout your entire GI tract. But ulcerative colitis, colitis colon ulcers, so that's where it's located. So there are keywords there: colon, inflammation, colitis. Reversed organs, situs inversus, site, side, inversus, inverted, flip-flop. So that's when everything on one side is moved to the other. It's flip-flopped. That's pretty straightforward. Fluid in the peritoneal cavity. Ascites, that is an abnormal accumulation of fluid. So fluid, water, all over, shouldn't be there. I just remember ascites, abnormal accumulation, AAA. So remember we had to know like at what point is your creatinine too high for like a contrast study or something. And I think I said like Cre 3. So if it's above, if it's above 3, then it's not good. Cre 3, just remember that. So I think I went over all those. We're good there. I'm going to go to chest and respiratory. This is going to be Kaposi sarcoma, common in AIDS patients. Emphysema, that's when you have all of that extra, the damaged air sacs in your lungs. And in this case, you are going to decrease your technique because there's all this air there. So you don't need to push through as much. So emphysema, COPD, those are ones where you are subtractive for technique. Remember the charts that said additive, subtractive? Emphysema is you're going to decrease because there's nothing there. It's just air. Decrease, subtractive. Mucus in the lungs, cystic fibrosis. That's where you have all that gunk in your lungs. And fibrosis, think of hardening. Cystic, I think of like fluid. So that would be CF. That's abnormal accumulation of like mucus and phlegm and all this gnarly stuff in your lungs. Occupationally inhaled dust particles. So it happens at work, occupation, pneumoconiosis. That one you just kind of have to memorize. But that's a lung issue and it's from inhaling all this crap basically. So pneumoconiosis. Let me go back to that. No, not that one. Pulmonary fibrosis resulting from occupationally inhaled dust particles. So pulmonary, that's going to be your lungs. And something abnormal is happening, pneumoconiosis. Okay. That's all those. Moving on to urinary, reproductive, hemo, endo. Growth hormone, acromegaly. Remember, mega, big, acro, like height, peak, too much growth hormone, everything's big. Acromegaly. Missing a kidney. So when you don't have something or it's without, agenesis, not formed. And then renal means kidney. So this is, you're missing a kidney. Kidney without formation. Medical emergency, twisting of the spermatic cord, cutting off blood supply. This is going to be testicular torsion. Remember the twisting. So basically twisted testicle, there's no blood supply there. The heck? That was a weird one. Medullary sponge kidney. Let me go back to that. So that's kidney. Medulla is internal. Looks like a sponge. Let me go back to that one. Okay, dilation of the renal tubules. Okay, and those are within the renal medulla, leading to urinary stasis and increased calcium phosphate. Okay, just remember it's the medulla, so that's inside the kidney, and it's talking about the tubules and dilation. It's a weird one. Medullary sponge kidney. All right, dilation, calcium phosphate buildup. All right, this one. Autoimmune, too little cortisol. Remember, there's one that's too much, and then there's one that's not enough. So this is too little. This is going to be Addison's. The way I remember it is Cushing's, C, cortisol. That's where you've too much cortisol. And this one's the opposite. This is not enough cortisol and not enough aldosterone, A, Addison's. So that's how I remember the two. Too much cortisol, Cushing's, too little cortisol and too little aldosterone is Addison's. Everybody okay with those? We'll go to the last column. Okay, central nervous system and trauma. Infection of the brain. Encephalitis. Okay. Itis is inflammation, the brain, and ceph. So just brain inflammation. Straightforward. Or infection, whatever. This one. This is a concussion. That's where you have like a blow to the head and you have, you know, headache, vomiting, nausea, but you can't actually like see anything. It's like common, and it's a common like football injury. It happens to kids a lot. It's like temporary brain paralysis. It's like your brain's kind of shaking around. So that's a concussion. Oh, I just did that. Sorry. Bone death. So death, necrosis, no blood supply without vascular, avascular necrosis, without blood, death. Air in the abdominal cavity. I've talked about this several times. Air in the thorax is pneumothorax. Air in the abdomen pelvis is going to be pneumothorax. peritoneum, peritoneal cavity. That's the football sign that we see. And let's go to the last one. Contusion. So remember, there's one that's the same side and there's one that's the back. So the first one would be same side would be coup lesion, opposite side would be contra coup because it's opposite, it's against. Okay. All right, so I'm gonna just do a quick front back on all of these, like I just did for the images, and then I'll stop recording, and then I'll talk to you for a few minutes. So we're gonna go back to skeletal, dwarfism, achondroplasia, type of dwarfism, rickets, osteomalacia, premature closure, craniosynostosis, brittle bone disease, OI, osteogenesis imperfecta, zebra stripes. Looks like, OI looks like what? Zebra stripes, okay? Difficulty swallowing, dysphagia, inflammation, colon, ulcerative colitis, reversed organs, situs inversus, fluid in the cavity, abdominal cavity, ascites, creatinine, Cre3, so anything above 3 is bad. Okay, this column. AIDS patients, Kaposi sarcoma, emphysema, you're going to decrease your technique. Inflammation in the legs, blockage. Did I do this one? Oh, I missed that one. Oh, thrombophlebitis. Okay, so inflammation, thrombus, clot, vein. Let me go back to that one. Oh, because you get like DVTs and clots in your legs. Okay, so that's this one. Inflammation can happen in the veins, blood clot, thrombophlebitis. Mucus in the lungs, cystic fibrosis, what happens as a result of inhaling dust, pneumoconiosis. Okay. Growth hormone, acromegaly, missing a kidney, renal agenesis, twisting the spermatic cord, testicular torsion, dilation of the renal tubules, medullary sponge kidney, not enough cortisol, not enough aldosterone, Addison's. And we'll go to this column. Brain infection, encephalitis, temporary brain paralysis, headache, vertigo, vomiting, concussion, bone death, not enough blood supply, avascular necrosis, air abdominal cavity, pneumoperitoneum, and contusion, opposite side, contra coup lesion. And stop share.